Hello everyone and welcome to episode 52 of the EMDR Doctor Podcast. I'm Dr. Caroline Lloyd and it is a long time since I've been pregnant. But one of the things that I remember about pregnancy is the nausea, that constant feeling of wanting to vomit for the first 12 weeks of pregnancy, roughly. For some people like me, it was about more like 14. Wanting to eat but not being confident to keep it down, and planning the first breakfast to be something like porridge that is easy to, shall we say, see a second time. Now, that was one of my least favourite things about pregnancy. It didn't stop me going back for a second time, but it was pretty rough and awful the first time round. But if I had had a more serious version of morning sickness, which is called Hyperemesis gravidarum, I would have had to have thought long and hard about another pregnancy. Hyperemesis gravidarum is when nausea and vomiting persist past the usual 12-week mark and make it impossible to keep down enough nutrients or fluids, and both mother and baby get dehydrated and lose weight. And it can be a really serious condition that leads to the mother being admitted for IV fluids and sometimes for IV feeding. And it is really unpleasant. And why am I talking about pregnancy at the ripe old age of 57? Not because it affects me, I have to say, but I do work with a lot of young mums, some of whom are planning pregnancies and thinking about the effects of the pregnancy on their body. And also because recently a good friend of mine, Angela Chadwick, who's an EMDR practitioner and specialises in working with women in the perinatal period, she sent me an article about EMDR and hyperemesis. So, this article explored the role of EMDR with hyperemesis and recounted a series of 5 case studies of women who were admitted to hospital with hyperemesis and who were given 1 or 2 sessions of EMDR. And lo and behold, 4 out of 5 were able to eat and go home, and they didn't need to get readmitted. So the nausea had resolved enough so that they were able to cope at home like a normal pregnancy. So what do we make of this? 1 or 2 episodes of EMDR can assist this severe state of prolonged morning sickness. How does that work? So we know that during pregnancy, our sense of smell goes on overdrive. We can smell much more acutely. And there are reasons for this, probably as a survival mechanism. So if we smell better, then we are less at risk of eating something that might be off and harming our baby by getting gastro or becoming very unwell from eating something that's bad. So the authors of this article suggest that with this really severe morning sickness, the brain gets sensitized to the smells that bring on the nausea. So what is the process of getting sensitized? So what this means is that, first off, the hormones cause some nausea. That's very normal. Then the woman gets exposed to a certain smell. For me, it was leeks. I could not stand the smell of leeks during my pregnancy. The body reacts to this smell and causes vomiting. And then the brain reacts to the vomiting and learns that that smell is intolerable because it has caused vomiting. So even when the hormones settle down, the smell of leeks still causes vomiting. And then the body goes, oh, that smell is really dangerous. And so the brain looks for this smell of leeks. The brain is in a state of searching for danger, looking for smells, and it comes across another bad smell, let's say onions, which were another trigger for me during pregnancy. So if my body is already primed, looking for dangerous smells that cause vomiting, and my body smells onions, then even if previously onions just caused nausea, with the brain on high alert, already primed for danger with strong smells, then it will cause a signal to vomit. So that I learn, I say learn in inverted commas because all of this is subconscious. It's not within my conscious awareness. I learned that onions are dangerous too because they cause vomiting, and then I'm on more high alert, and if I smell something else, maybe, I don't know, unrelated like cleaning products, and my body is primed for vomiting, I start vomiting with any smell at all. The smell of cardboard or a paper bag, or even the sight of the bathroom door, because this is where I do the vomiting, so it must be dangerous. Or then even maybe the feeling of something in my mouth, because that might be dangerous. And hence my brain gets sensitized to virtually anything, with tiny little triggers causing nausea and vomiting. And then I might get really afraid to eat because everything I eat just comes up anyway. And I end up dehydrated and very unwell, and off to hospital I go. So something that started with normal nausea from pregnancy hormones ends up with me in a hospital on a drip and terrified to eat. So what does EMDR do? It seems that EMDR can break that link between the trigger and the danger and the bodily response. So it stops that escalation of the nausea, it stops the priming for danger, it stops the generalization of the triggers, and it settles down the body response. So I'm not promising the end of all nausea in pregnancy. That would certainly be incredibly miraculous. But EMDR does seem to halt that escalation from standard morning sickness into that more serious form of morning sickness called hyperemesis gravidarum. It may be able to prevent lots of admissions to hospital and many days of nausea torture for lots of women, which would be an amazing and a brilliant use of a very simple therapy. No IVs, no tablets, no hospital admissions, less vomiting, very happy mothers, happy doctors. So if you are interested in the article itself, I will put a link to it in the show notes. It's called EMDR for Hyperemesis Gravidarum, a case series by Onda Kavachi, I'm not exactly sure how you say that, and Gonca Emir Yenisescu. It's a beautiful expression of the wonder of EMDR into yet another area of dire need. I'm very excited about it. I hope this has been helpful to you. I will talk to you again next week. Take good care. Bye for now.